I'm going to show you one of the most common rashes or skin infections that we see in the pediatric population. It looks pretty scary or gnarly, but it is considered a mild infection that will get better with treatment. But you do need to see your doctor for treatment because topical antibiotics that you have at home won't work. This is your trigger warning. You have like 2 more seconds to scroll away if you want to. But again, this is going to be bullous impetigo. You can have regular impetigo that's kind of crusty, sores around the mouth and nose, or other parts of the body, but this is bullous impetigo. This could be anywhere on the body, but commonly on the extremities or the trunk. And this is very itchy, so kids often scratch it, and then they auto-inoculate or spread it to other parts of their body. So this was the first one, and then they spread to multiple other locations through scratching. This bacteria can spread to other people through different surfaces, like gym equipments, wrestling mats, different costumes or linens, and so we can reduce it by not sharing those surfaces or making sure we're cleaning in between. Impetigo is typically caused by staph or strep infection. So Staph aureus is a type of bacteria. MRSA is one type of it that's methicillin resistant, so you need special antibiotics, or group A strep, which can cause strep throat, but can also cause infections in other part of the body as well. This kiddo is contagious, so contact with these spots could spread the infection, so these do need to stay covered, and the patient needs to wash hands frequently with soap and water. If this were just one single spot or 2 single localized spots, we would treat with topical antibiotics, so an antibiotic ointment that we would put on the skin. We would typically use something like Bactroban or mupirocin, but because there are lots of lesions, this thing is spreading, unfortunately. This kiddo also needs some oral antibiotics, so they were started on Keflex or Ceflexin. Kiddo did Bactroban on the skin and 5 days of oral antibiotics and had complete clearance about 10 days later. It is also important to remember not to share things like towels and other linens because this can spread to other members of the family as well.